In tonight's Health Edge, new numbers out showing more than 90% of patients with chronic pain that have overdosed on opioids. They're still being prescribed those painkillers even after that brush with death.
So is the system failing them? Chief Health Editor Dr. Partha Nandi joins us now. Who's to blame? Is someone to blame here?
You know, it's astonishing when you hear the statistics that people are doing. And I think also, and you know this too, if you've ever gone to a pharmacy, you know, doctors often don't know what other doctors are doing. So often when I get a patient that comes to me, I haven't seen them before. I don't know if another doctor has prescribed it. So really, you know, we have to network and understand what's going on. I think this electronic medical record system where doctors talk to each other, I think is really important.
I was going to say, is there an easier way to communicate? Because at one time you had to shuffle all your paperwork to whatever doctor you were going to.
Yeah, there is an app system where you know, pharmacies actually talk to each other, meaning that if, for example, if you go to one pharmacy and give a prescription from a doctor and then you go to another pharmacy, they can keep track of it. I think electronic medical records, unlike any other time, doctors are talking to each other. So if I prescribe an opioid, somebody else can as well. So I think it's important, communication is important, but we also have to recognize the signs of addiction.
Is Obamacare forcing this more and more, the electronic records for medicine?
I'm one of the few doctors that you'll probably hear that support this kind of stuff, because even though it's kind of a pain sometimes, you know, some of the things are very onerous, but I think at the end, the goal is to communicate and get better patient care, and I think this achieves it. There are some problems with Obamacare, the Affordable Health Care Act, but this I think will help with communication. But I think we need to let people know or watching what are the signs of drug addiction. Number one, if you're taking opioids and you have to keep increasing the dose, and you can't effectively come down on it, important, that's the sign. Also, if you have physical or emotional withdrawal when you try to get off of the drugs, important. Also, you spend a lot of time trying to get the drugs, go to doctors, try to figure out ways to get it. Those are signs that you're getting addicted. Remember, you can help yourself more than anybody else. So if you see signs, get help.
All right, Doc, thank you. We appreciate that.
Absolutely, and if there are any family members that are watching, remember, if you see those signs of drug addiction, intervene. Remember, let them know non-confrontationally that you are there to help, and then offer them services, offer them to see a physician, a therapist, and have an intervention. Have other loved ones that come through and say, listen, you know what, we can get this and beat this, because it's a huge problem in our country as well as the world.
Yeah, so important. Doctor, thank you.
Thank you.
Thanks so much, Doc. If you have a question for the good doctor, you got a health concern, you can email him at drnandy@WXYZ.com or send it to us, Facebook, Twitter, email, give us a call. We'll get it to him.